If you look at population studies, people that feel fine, that feel as if they've slept well, are sleeping between 7 and 9 hours, with an average around 8 hours and 15 minutes or so. Teenagers is a little bit more skewed towards the higher numbers, so maybe it's more like 8 to 10. Okay, they do need more. And you know what's the funny thing is? They tend to get much less. There are reasons for that. But the right amount is the amount of sleep that you need, given the opportunity to sleep as long as you want to, and you feel fine as a result of that time of sleep. I'm a 7.5 to 7.75 hour person. Okay, that's what I need to sleep and feel perfectly fine. And I know, because if I get less sleep, I don't feel good the next day. But you know what's something really interesting? And a lot of people do this, and they think that it's almost like a good thing. They'll start to sleep deprive themselves so that they only sleep 7 hours or 6 hours, and they say, I'm getting used to it. That is as silly as saying, you know what, I'm going to smoke a cigarette, and initially I'm going to cough, wheeze, this, that, but after 2 weeks, nothing will happen, so I'm used to it, which means it's now okay to smoke. They're both silly, okay? You can't get used to not sleeping long enough. A lot of patients will say to me, what can I do to replace sleep, because I need more hours out of the day? And my answer is very simple. It's a one-word answer: nothing. There's nothing which can replace sleep. What sleep does for you, it needs it to happen at the right time, at the right quality, and at the right duration. There's nothing that can replace that. The amount of sleep is different for children and adolescents, adults, and even older adults. So the numbers I was giving earlier has to do with adults and not older adults. And what we do find is children before puberty, they require a lot more sleep. And parents are very thankful of this. So they can sleep 12 hours at night and take 2 naps. And that's when they're celebrating because they can be a bit difficult in between, of course. But yeah, children, babies, infants, toddlers, and children do need more sleep. As they get older, they don't need those naps, but they still need a lot more sleep, 9 to 10 hours. When they go through puberty, 2 interesting things happen. One is that they don't need as much sleep, and they can get by with 9 hours, maybe even 10 hours, and feel perfectly fine. And the second thing which happened is they experience a delay in their sleep phase. So the time that their brain says, I now want to go to sleep, becomes delayed. So normally, let's say they're going to bed at 8, now they want to go to bed at around 10 or 11. Drives their parents crazy. You know, you got to get up at 6 o'clock in the morning to go to school. You can't go to bed at 11. But Mom, I'm not sleepy. I got things to do. So what happens? They get 7 hours. They're tired all day. That's a major problem in this country, a major problem. There's actually bills being written in the government to see if they can start school later, because parents and children don't know what to do about this sleep deprivation that they're going through. Now, by the way, if they come to my office, I advise them to do several things. One is, if possible, take a nap in the afternoon. Naps in the afternoon can be very healthy for you. If done at the right time, for the right amount and good quality, for example, a nap of about an hour, maybe an hour and a half in the afternoon done by a teenager can be wonderful. Then they can stay up until 11 and get up at 6, and that's okay. Biphasic sleep has been shown to be just as effective, and in some cases even more effective. The other thing which I say to them is I can try to phase delay them, try to phase advance them, advance their sleep so that they're getting to bed earlier. And there are some methods that we can help them do that. A lot of teenagers don't want to do that, but that is something that can be done. As adults, we don't need as much sleep, but again, we do need somewhere between 7 and 9 hours, as much as it's necessary. Adults have a little bit of a better time knowing what to do about their sleep. They're a little bit more responsible than teenagers. Not by much, but they are. Older adults, they seem to need less sleep. In fact, what seems to happen with them is the amount of deep sleep tends to be lessened. So there are 3 stages of sleep: N1, N2, and N3. N3, also known in the past as stage 3 and stage 4 sleep, is the deepest part of sleep. We think that perhaps it is the restorative, rejuvenative, and reparative part of sleep. But nonetheless, that part gets eroded the most when patients become in the elderly population. There's some evidence that shows that those that don't erode as much as stage 4 sleep are possibly healthier. None of that has come about too clearly. There have been some methods that were being researched to see if we can increase the amount of stage 3 sleep and 3 sleep in our patients to see if they would actually be healthier. More research to come. But yeah, clearly older adults, they sleep more like 6 or 7 hours. But interestingly, they spend more time in bed. And what we're saying about that is, well, they probably don't go to work and they're retired. So when they wake up in the morning, they'll stay in bed for an hour or so and then get up. So they spend more time in bed, but less time in sleep. Sleep in general is totally underappreciated in medicine, and all the particulars of the problems that occur as a result of poor sleep are especially underappreciated. It all starts in medical school, where very, very little is taught to students, and then in residency, even less. One of the interesting things that I do is I am involved in clinician education, and I go to residency programs, and when I give talks to them, it's information they've never heard before, not just them, but also the attending physicians. So it is to me a tragic situation, because sleep itself is such a huge component in life. Just imagine, you spend 1/3 of your life in sleep in general, 1/3. There must be a huge need for it. You don't do 1/3 of anything in life. You don't spend that much with your spouse or play with your kids, or 1/3 of your life. And it's interesting that in order for that 1/3 to really do its thing, it's got to be healthy sleep. So not only is it underappreciated how much of a duration of sleep that we need, what it does, the quality of sleep, and what happens when it's broken, and how good things can be when they're fixed. In primary care, do clinicians appreciate the benefits of sleep, and do they also especially appreciate the perils of poor sleep? And the answer to those, in general, are no. There are some exceptions, but for the most part, clinicians don't really want to bother with sleep for many reasons. First of all, we're very much motivated by other people telling us what we should be motivated by. We have insurance companies, HMOs, et cetera, even Medicare telling us these are the parameters that we're going to look for. We're going to look for making sure you have your vitals taken care of, that you're doing your immunizations, that if the patient has a diabetes, that all of the important visits and parameters are cared for. Immunizations are done, as I said. Screening tests are done. So by the time you're done all the things that everybody wants you to do, there's not much left for other things, especially sleep. And especially when a clinician already feels as if sleep is not really that critically important. Or maybe looking at it this way, all right, so if there's something wrong with somebody's sleep, let them try to fix it first. And if they come to me, I'm going to sort of, let's say, minimize it. Because if I minimize it and they accept it, then we're done. That's pretty much how it is in sleep, which is, again, as I said earlier, somewhat tragic, because sleep is critical for good health. It's critical. The cornerstones of good health, if you will, there are 4 of them. One is good eating habits, one is good exercise habits, one is rest and relaxation, and the final 4th one is good sleep. It is the cornerstone of good sleep.